Hello, welcome to Healthcare Journey. Today we are going to be looking at the probable signs of pregnancy. You may be wondering how midwives and doctors confirm or suspect that a woman is pregnant, even before ultrasound confirms it. In our last presentation, we looked at the early signs of pregnancy. We looked at especially the presumptive signs. And later on, we looked at the skin changes in pregnancy, which are part of the presumptive signs. Today, we are going to be looking at a more stronger indicator of pregnancy, which are the probable signs of pregnancy. We also have the positive sign, which are the ones we are going to be talking about later, but not in today's presentation. So probable signs are stronger indicators than the presumptive signs. They are not 100% conclusive. They are not 100% indicative of pregnancy, but they are stronger indicators than the presumptive signs. So as I share my slide, let us flow along with the slide and pay attention. If you find the video helpful at the end, please comment, share, like, and talk about it with your friends. So let's pay attention while I share my slides. So what are these probable signs of pregnancy? They are the objective changes observed by healthcare professionals that really indicates that there is possibility the woman is pregnant. There is every likelihood that that woman is pregnant. There are physical changes that the woman experiences that are observed by healthcare professionals, which can be the midwives or the gynecologists, the doctors, the healthcare workers who see these women when they come for ANC or when they appear in the hospital. They are not conclusive signs, as we said. So we are going to be taking them one after the other. The first sign we are going to be looking at is the Chadwick's sign. Chadwick's sign is a bluish or a purplish discoloration of the vagina, the cervix, and the vulva. The vagina walls, the cervical area, the cervix is bluish in color in Chadwick's sign, and it is caused by an increased vascularization and blood flow towards these areas I've mentioned. It is usually seen around the 6 to the 8 weeks of pregnancy, 6 to the 8 weeks after conception has taken place. It is considered a probable sign of pregnancy because they are not exclusive. These signs we are talking about are not exclusive to pregnancy, because there are other different conditions that can also present this sign. Conditions like pelvic inflammatory diseases, where you have hormonal changes too, or when you find a woman who is on a hormonal therapy, maybe taking high dose of estrogen therapy, it can also cause this type of a sign, the Chadwick's sign. So in cases where there is a chronic inflammation of the cervix, like in chronic cervicitis, it can lead to discoloration of the cervix, and so many other conditions. Varicosity of the cervix or the vagina can also lead to discoloration. This bluish appearance may be seen around the cervix, the vagina, or the vulva area. So that is why we call them the probable signs, because they are not particular about just pregnancy. Now let's look at the diagrams here. This is the cervix we are looking at here. The view of the cervix as seen through the vagina. When the vagina is opened, the doctor is trying to view the cervix to confirm this sign we are talking about. The vagina is opened with this cuscus speculum. When it is opened, this is a diagram of where the vagina is opened, and this is the view of the cervix. You can see that the view here, the cervix here is bluish in color. Look at it here too. This is the cervix. That is the cervical os here. There's a bit of discharge there, but this is what we are really looking at here, is the discoloration, the bluish discoloration of the cervix. So this bluish discoloration is what we refer to as the Chadwick's sign. Now we'll go over to the next sign, the Hegar's sign. So Hegar's sign is the softening of the lower uterine segments, especially the cervical isthmus. It is felt during the bimanual examination. That is when this sign is felt, and it is always seen between the 6th to the 12th week of pregnancy, the very first trimester of pregnancy. However, this sign we are talking about, like other probable signs, are not exclusive to pregnancy, because there are other conditions that mimic Hegar's sign. And some of these conditions are the presence of the uterine fibroid, endometrial polyp, pelvic inflammatory diseases, when the cervix is traumatized, like in uterine instrumentation, and even intake of high doses of hormonal therapies like estrogen therapy. The cervix can present with this. If bimanual examination is conducted, the cervix might, especially the lower segments, might be soft on examination. So this is the diagram representation of the bimanual pelvic examination. This finger we are looking at here went through the anterior fornix of the vagina, while this other finger is above the abdomen, and two of them are meeting at the point of the cervical isthmus. This is the part that is felt as being soft in Hegar's sign. So we go over to the next sign that we have here, the Goodell sign. The Goodell sign is a softening of the cervix, which is due to increased vascularization and also edema of the cervix. When we say vascularization, we mean increase of blood flow towards the cervix, which occurs mainly during pregnancy as a result of the hormonal changes that happen in pregnancy. It is not a definite sign of pregnancy. There are other conditions that may make Goodell sign. And we have one, the inflammation of the cervix that we refer to as cervicitis, even in hormonal changes, hormonal therapy, use of oral contraceptions or oral contraceptives, even when there is trauma to the cervix, like in uterine instrumentation, in cervical cancer, in cervical polyps, and even also in the luteal phase of the menstrual cycle. The cervix can present as being soft. The cervix will be soft in these particular conditions that we have mentioned. So Goodell sign, just like the Chadwick sign or the Hegar sign, they are not conclusive signs of pregnancy. They are more stronger than the presumptive. And here we have a diagram showing us the cervix. This is the area that we talked about that will be soft. This point now, this point is where we refer to as the cervix that becomes soft. And when the cervix becomes soft, it is referred to as the Goodell's sign. Now we go over to Braxton Hicks contraction. This is another probable signs of pregnancy. The Braxton Hicks contraction is a painless, irregular contraction. Painless, irregular contraction that often starts between the second and third trimester, the second and third phase of pregnancy. In every particular journey or pregnancy journey, the woman experiences this Braxton Hicks contraction that occurs around the second to the third trimester. Some people refer to it as false labor because it is not consistent, the contraction is irregular. Most at times it is painless, though it is not comfortable for most women, but you can easily differentiate it from the real labor. It's like some people refer it as a way the body gets itself ready for the real labor. Some feel it as a mild menstrual cramp, and some feel it as a random tightness in the abdomen. We have a presentation here that says briefly about this Braxton Hicks contraction. Occurs between the second and third trimester, and in this contraction the uterus contracts and relaxes. It's not continuous, so the contraction, they are mostly irregular. It is referred to as false labor, as we have mentioned, and there are things that triggers it, like when the woman is very active. Even dehydration can also cause it. Distended bladder can lead to it, or even sexual intercourse. The woman indulging in sexual intercourse can also result to Braxton Hicks contraction. To get relief from this contraction, it is encouraged that the woman changes position or moves around, because it will help to alleviate the symptoms. So that is Braxton Hicks contraction is one of the probable signs of pregnancy. Now we look at the uterine enlargement. In uterine enlargement or abdominal enlargement is also a probable sign, because yes, the abdomen is obvious that it is growing, especially if the woman have not done any ultrasound. You could see that the abdomen is growing, but you cannot definitively say that it's pregnancy except ultrasound is carried out, or maybe it's already confirmed with a pregnancy test. Though there are conditions that can also give positive results, which we will still talk about. So the uterus grows and can be felt above the pelvis. Let us remember that the uterus is a pelvic organ, but in pregnancy it grows to become an abdominal organ. So conditions that can present abdominal enlargement or uterine enlargement is uterine fibroid, cases of cancer, cases of adenomyosis. Adenomyosis is where you have the endometrial tissues of the uterus growing into the uterine muscles and making them to enlarge, making the uterus to enlarge. So that is the adenomyosis. So in such cases, the uterus grows and is obvious in the abdominal wall too that it is growing. So that the uterus is enlarging, abdomen is enlarging, is not a definite sign of pregnancy. You could see here, this is the uterus, which is a non-pregnant uterus that is here, which is a pelvic organ. At 20 weeks of pregnancy, we could see now that the uterus have grown out of the pelvis, growing into the abdomen now, and this is it at 32 weeks. So that is the enlargement of the uterus and enlargement of the abdomen. Enlargement of the uterus and the abdomen. Now we move over to the next sign that we have here under probable sign is the positive pregnancy test, HCG detection. Some people may be wondering, why is a HCG detection one of the probable signs? It is because there are conditions too that can give rise to positive or false pregnancy results. Conditions like in recent miscarriage. Let me say the woman just lost a baby. If the woman goes for tests, the test will show positive because the pregnancy hormones are still very present. They have not really gone out of the bloodstream. So the woman will test positive for pregnancy after a recent miscarriage. In ectopic pregnancy, pregnancy outside the uterus can also test positive. In gestational trophoblastic diseases like molar pregnancy, hydatid deformo, which we call molar pregnancy, maybe a failed pregnancy turns to a molar pregnancy, can give a positive pregnancy result. The woman will be thinking that she's pregnant, unknown to her. It's only ultrasound that will now say that this is a molar pregnancy, it's not an actual pregnancy. Even in chorion carcinoma, in ovarian tumors, they can also give a positive pregnancy result, because at this point the HCG level in the blood is at an increase in these conditions that we have mentioned. So here we have positive results that shows possibly that the woman is pregnant. When we look at these tests of the HCG, when there are two bold colored positive lines, it shows that the woman might be pregnant. The C here is for control, the T here is for test. So when it's only showing in the where we have the C, that means the woman is not pregnant. Like here, this is just one line. This line is not very bold and needs to be confirmed again with another test. Why this one shows a confirmed pregnancy results. But what will actually say that this woman is pregnant when the woman has gone for other possible tests like ultrasound that will detect, or maybe when you hear the heartbeat, you will now say this is a positive sign of a pregnancy. So that is it. We move over to, now we look at the differences between presumptive sign, probable signs, and positive signs. Just a simple way of describing it. The presumptive signs, they are the signs felt by the mother, like when you have nausea, vomiting, weakness, missed periods, which we also refer to as amenorrhea. They are all the presumptive signs that we have talked about before. The probable signs is what we just talked about in this one, the Hegar sign, the Chadwick sign, the uterine enlargement, the Goodell sign. They are the probable signs because they are the signs observed by the healthcare workers, healthcare providers. While the positive signs are the direct evidence. This is just evidence, a confirmatory sign that the woman is pregnant, especially signs like when you confirm this woman is pregnant through ultrasound, through a pelvic ultrasound or an abdominal ultrasound. Then a fetal heartbeat is heard during the examination of the abdomen. You listen to the fetal heart. So these are the positive signs. So looking at this is just a brief difference between the three in a very simple way. So with this, we'll draw a close to our presentation. Thank you so much for listening. If you find this video helpful, please like, share, and comment. If you have other things that you would like us to talk about, please don't fail to engage fully in this video and put on your notification button so that when we share videos of this kind, you will always get notified. Thank you so much for coming around. See you in our next video.